But I want to welcome you to my constituency, Portsmouth. Portsmouth is very unique and very special, as you all must have discovered already. I believe it's the most beautiful part of Dominica. I mean, you have the beaches, you have the Fort Shirley, the Cabrits. You know, Portsmouth is so full of heritage and history and culture. And I was just explaining to the guys, the technicians and the photographers here while we sat outside waiting for the opening, that this place really was a dump. We used to use it to dump garbage, and some persons would come here in the mud to look for crabs and stuff, you know, some older people with lamps in the nights and stuff, what we call buzai, which is a locally made flambeau. And a couple of years ago, it was transformed into this beautiful Kempinski Hotel, which we're very proud of, and I'm very happy to welcome you. I found out that this meeting has been in the planning for about 2 years now, that I'm sure Dr. Etienne was eager to invite you to, but COVID unfortunately delayed your visit by 2 years. But we are happy that we are nearing the light at the end of the tunnel, or turning the corner as far as the pandemic is concerned, and it is now possible for you to be here. So I want to welcome you to the Nature Isle, to Nature's Isle, as we say in Dominica. I don't know if some of you all may still be here on island on Sunday, but we have a national event called the Jazz and Creole up on the fort, which is a very nice event. So if you all are here, you can really experience some of Dominica's best musicians, and really the atmosphere, the natural atmosphere of Dominica is very nice. So I hope that I want to invite you all, if you are still on island on Sunday, to Fort Shirley, which is maybe 5 minutes walk from here, from the Kempinski. So I feel very privileged to participate. And another secret, that before I actually start, I am not actually the parliamentary representative for this location, but all of Dominica feels that this area is part of the town of Portsmouth, but the boundaries actually are about maybe 5 minutes south of us. So myself and the senior minister, who is actually the parliamentary representative, Honorable Reginald Austri, but somehow I always get invited to activities at the Kempinski, because all of Dominica, which is a nice little secret, is of the understanding that I am the parliamentary representative for the entire area. So I feel privileged to be here to participate, you know, in this morning's opening ceremony. Privileged because it gives me the opportunity to reflect on the sterling contribution of a group of highly skilled and experienced professionals who have led us with distinction in our fight against COVID-19 over the past 2 years. We thank PAHO for its conscientious work on the ground here in Dominica, which has included support in the form of valuable resources, transportation to go all over the country, really, you know, promoting the vaccination program and the fight generally. And by the way, we were fortuitous in the sense that a misfortune which happened after Hurricane Maria, which destroyed the country, as you know, and caused our offshore university, Ross University, to exit Dominica to Barbados, really came at an opportune time, because we were able to actually set up an entire hospital to care for COVID-19 patients. And I, being the parliamentary representative for the area, was actually very much involved. You know, I have a whole team as a politician. I have different teams for different things, and I pull them into action at different times. So I got all of my technicians with their power saws and their power tools, and we actually outfitted a university into a hospital under a matter of 10 days, outfitted with beds and all of the equipment, and we worked night and day, and I was fully involved. Actually, there was a small clip, a small video circulating about me where I was actually emptying a dumpster, and people say, wow, look at the minister and the parliament, he's so involved. But I felt that I had to get involved because, at that time, the COVID-19, pandemic had just struck Dominica, really, for want of a better term, and everybody was mobilized into action. And I believe from the first day that the Prime Minister announced the actions to be taken right up until today, I think that is what really allowed us to really get hold of the situation and be so successful in our fight against the pandemic, because there was leadership at every level, from the top coming all the way down. All of the nurses and the doctors and the technicians and the carpenters and the masons, the plumbers, everybody was so involved, and I believe that really helped us. So I was really on the front line, in our defense. So I'm very happy that I was able to contribute and be part of our fight. So I want to thank PAHO for their contribution, and all of assisting us in our vaccination efforts, as well as, a large quantity of medical supplies, which was provided, the technical advice, the guidance we needed, the training for our healthcare providers during the early days of the pandemic really proved crucial. And that is why we are here celebrating the kind of success and being really a model for the rest of the region as far as our success in this fight is concerned. So indeed, we remember clearly that in February of 2020, PAHO conducted training in COVID-19 testing for our lab technicians, preparing them from the onset, even before this thing really took hold and was blown out of control. PAHO was there with us, almost like they knew in advance, what had to be done, preparing our technicians for the outbreak of the virus here in Dominica. And we will also remember that Dominica was one of the first in the region to conduct testing and to receive quantities of vaccines, really, life-saving vaccines. And in all of this, PAHO has been at our side, ensuring that we were equipped in our management of COVID-19 and in our efforts to save lives and to protect the health of our nation. I note that in one of those areas of focus this week that you will deliberate on is enhancing our primary healthcare systems. And of course, I told you, although I'm not in the medical field, I understand the workings of primary healthcare because I grew up in it, and I grew up in the household of a nurse. And so we know that Dr. Etienne is very passionate about primary healthcare, and we share her conviction at the policy level that healthcare systems must be strengthened at this initial level of service delivery to ensure the collective healthcare of our nation. And it's no secret, in Dominica, at the policy level, at the political level, health is one of the pillars of the economy. Health and education enjoys some of the biggest chunks of the budget in Dominica. We spend money on healthcare because we believe that it's important to us. If we do not have a strong healthcare system, it affects everything, all of our productivity going right down the line. So we share her conviction that our health system must be strengthened at this initial level of service delivery to ensure the collective healthcare of the entire nation is very important. As government, we have redirected our energies to creating access at the primary healthcare level and enhancing facilities to provide quality service to our citizens. And you must have known we have built about 14 health and wellness centers already. We have a new hospital in Marigot. We have the new China Friendship Hospital coming on. So our passion for healthcare is clear in the investments that we continue to make in the healthcare system. So, and I note that, like I said, we have constructed 12 new health and wellness centers across the island, and there are more to come, the Marigot Hospital. And that is because the aim of this government is to provide a broad range of amenities at the primary healthcare level, which support the delivery of consistent, free, and excellent healthcare services. We want healthcare to be free for all. When they come to the hospital, every citizen, no matter your station in life, you must be assured that you will get the quality of healthcare that you deserve and that is available on the island free of charge for all our citizens. And we do so because we understand the importance of the preventative care at the community level and how this can improve the general health outcomes of all of our population. A healthy population is a productive population. A productive population creates wealth for all. And so we want to empower our citizens to eliminate and to prevent the risk factors which lead to the chronic illnesses we are most familiar with here in Dominica. And that is why chronic non-communicable disease, we have launched a campaign against the CNCDs to eradicate them from Dominica. We are all aware of the high incidence of diabetes, hypertension, and heart disease, which often lead to stroke and diminished capacity or even worse, death. When we consider the impact of these on the quality of life and on the well-being of families across our country, and especially on the productive capacity of our citizens in our country, we see how critical it is to arrest this disturbing trend now, right now. We don't have tomorrow. We don't have the luxury of tomorrow. We have to do it now. Our focus is on creating accessibility to early diagnosis and treatment of health conditions and support and management of chronic conditions, especially among our elderly who are most afflicted with diabetes and hypertension. Our efforts are about the equitable distribution of care across all our communities, which will play a critical role in shaping the overall health and well-being of our people and our country. These issues are not unique only to Dominica. That's why you are here today. It's not only Dominica who face this predicament today. And I expect that PAHO remains preoccupied about such matters of equity and access in countries across the Americas. And I know that you will go to the other regions of the Americas after you leave Dominica, which I believe represents the Caribbean catchment. As we continue to battle with the COVID-19 pandemic, we are also concerned with equal access to vaccines for depressed populations in the region. Here in Dominica, we have been very successful, knock on wood, thank God, in our efforts to make vaccines available to every single eligible Dominican. And I still want to reach out to all of the citizens of this country who have not availed themselves of the vaccine. And there is still time to do it, and we should. I believe that we must aim for 100% vaccination in Dominica. We have been successful, yes, in our efforts to make the vaccine available to every single eligible Dominican. But we recognize that there is disparity in vaccine coverage in many of our counterpart territories, and we want to be able to work at eliminating that. And so, we pledge our full support to PAHO's objectives to increase vaccination numbers in our respective countries as part of Vaccination Week in the Americas, which was launched here yesterday, Monday. Our efforts in Dominica to increase our immunization numbers will only intensify despite our recent success in reducing our active COVID-19 cases. I expect that you will deliberate on all of those issues and more during your meeting as you devise even more targeted interventions to combat diseases in our countries and enhance health systems to provide citizens with quality care for a more hopeful, brighter future for all of us in the Americas. Once again, thank you for your partnership over the many years. PAHO has provided Dominica with useful technical support to fight diseases and strengthen our healthcare systems. And to that, we will continue to remain eternally grateful. And here comes my comrade, the champion of healthcare system in Dominica, and he has done a very good job. I don't know, it must have been, God must have been with us, because Dr. McIntyre became a politician about maybe a month or two. He became part of cabinet a month or two before the COVID-19 pandemic actually struck Dominica, and we could not have found a better champion, not only in the healthcare system, but throughout Dominica, to really lead us through the fight against COVID-19. And we're very happy to have him at the helm. Very blessed to have Dr. McIntyre. So, Doc, it's always a pleasure to welcome you to my constituency. It's Honorable Reggie's constituency, but I like to say it's mine. So once again, I want to say thank you to PAHO for your partnership over the years in providing Dominica with all of the useful technical support to fight diseases and to strengthen our healthcare systems. We have seen this partnership in action even more so in this COVID-19 pandemic, but our collaboration is wide-ranging, and we are certainly grateful for all of the support provided in our quest to strengthen our primary healthcare system and to secure universal access and care for all of our citizens. Once again, I want to welcome you to Nature's Isle, to Dominica. I hope that you have very fruitful and productive deliberations here, because the entire Americas depend on the deliberations you have and the outcomes of this meeting. God bless you, God bless your efforts, and thanks for inviting me. Thank you very much.
As a good Boy Scout, he kept the time as well. So I would like to invite Dr. Etienne to respond to the welcome remarks by the Minister before we move to the next item.
Thank you, Godfrey. Honorable Ian Douglas and Honorable Irvin McIntyre, let me say, we almost thought that you were the Minister of Health, Honorable Ian Douglas, because you managed in your address you managed the health agenda very well. And it is clear that you were born into this thing, that it is very much part of you, and that you were present during the transformation, the earlier transformation in terms of primary health care. So we thank you for your memory, but more than anything, we thank you for your passion that you have exhibited. And we count on you that same passion will feed into this new cycle of transformation of the health systems in Dominica. You know that NCDs are the biggest challenge. We've been dealing with this epidemic now for many years, contributing to some 80% of the mortality. But importantly so, and you yourself alluded to this, it's the mortality, the premature mortality, striking down our people in their most productive years. And that is a huge problem for us in the Caribbean, but really throughout the world. And so we need to pay particular attention to addressing this NCD epidemic in terms of promotion, prevention, the care, and the rehabilitation and palliative care. And so we will work with this government at the invitation of the Prime Minister and the Cabinet for the transformation of the health systems, but with the emphasis on NCDs. So when we began primary health care, it was the emphasis was maternal and child health and communicable diseases, and that has shifted. And so we must make the adjustments in our systems to ensure greater coordination between primary and secondary care, to ensure stronger health promotion that focuses on NCD. But we need to also look at the health profiles, the skills, the competencies that are required at the first level of care to address NCDs. But you have a very important role to play in NCDs, Minister, within your portfolio for trade. One of them is, how do we create the enabling environments so people can live healthier lives? How do you lead the fight in ensuring, I know that we have taxes on sweetened beverages, we need to increase those. We need to increase those so the healthier choice becomes the easier choice. So they will not spend money to buy some of those, but they will go to our juices. And to put the taxation on sugar as well. So they will not drown the juices with sugar, no? So that's one of the things. However, one of the biggest requests that we need to make of you, sir, is how does CARICOM and the ministers of trade, how do they help us to ensure food labeling in the Caribbean? When somebody goes to a supermarket to pick up something, they need to know, ooh, this is high in fats, this is high in sugar, this is high in salt. So it becomes easier for them to make the choice. And so we've been having a battle with food labeling and with CARICOM and ministers of trade in this region, where they've been blocking us. They've been blocking us, although we have the support of CAFA and the Healthy Coalition and the civil society in this region. They've been blocking us. And I think it's short-sightedness, because unless we go to the food labeling, people will continue to buy food that is not just not healthy, but is causing illness. And the cost of dealing, the economic cost of dealing with those illnesses is much higher than the few taxes that they would pick up from those products. So that's my personal plea to you, Honorable Ian Douglas, that you bring leadership to bear on the front of package food labeling issue in the Caribbean. And Dominica can be that first. PAHO has done, we have studied this, we have done surveys, we have some countries, but we are getting, that have already implemented it outside of the Caribbean, but in the Caribbean we are having great difficulty. And that's where the NCD problem is even worse. So thank you again for this, and we thank you for your leadership that you will bring to this transformation within your constituency, because we are sure that it has to be an all-of-government approach, and it has to be an all-of-society approach if we are going to turn this tide on the problem of NCDs. So thank you again for your great sensitivity to the health agenda here, and the leadership that you can bring in your constituency. And don't worry that this is not yours. Honorable Reginald Austry is also well aligned as far as that is concerned. You should have heard him yesterday. Very committed at the regional launch of Vaccination Week. So I think we are building the commitment across the cabinet of Dominica, so all of the sectors will be engaged in that movement towards once and for all addressing the NCD agenda, successfully addressing the NCD agenda. So thank you again in your capacity as Minister of Trade, and also in your capacity as MP of this region. So thank you so much.
Thank you, Dr. Etienne. And a practical example of health in all policies and health across the government. I would like to now welcome the Minister of Health, the Honorable Dr. Irvin McIntyre. Dr. McIntyre is a medical doctor from a small community of Fontcani in the Roseau Valley. He graduated from St. Mary's Academy in Dominica and later pursued his medical studies at the Indira Gandhi Medical College in Shimla in India. He began to work here in Dominica at Princess Margaret Hospital shortly after his graduation, and rose the ranks to senior medical officer at the Accident and Emergency Department at the Princess Margaret Hospital. He later went on to move to private practice, where he was also a clinical instructor to students at the Ross University School of Medicine. Dr. McIntyre was also an active member of the Dominica Olympic Committee and the Regional Anti-Doping Organization. He was the physician for one of the cricket teams, football teams, the Boxing Association, and was also a former national basketball player. It seems that the Prime Minister chose a cabinet of a footballer, a basketball player. He had all the sportsmen from his political team. After Hurricane Maria, Dr. McIntyre managed the procurement and distribution of relief supplies in his constituency, and also conducted free health clinics in the capital city of Roseau within his community and the Hillsborough Medical Center. In 2019, Dr. McIntyre was victorious in the general election and won the Roseau Valley constituency seat. And later that month, he was sworn in as the new Minister of Health, Wellness and New Health Investment. He has shown genuine compassion in addressing the needs of all Dominicans and was selected as the Person of the Year 2020 in the Commonwealth of Dominica by the two main newspapers in the country, a choice which was pleasing to everyone. Dr. McIntyre continues at the forefront of the fight against COVID-19, but as you've already heard, he is also the cabinet lead in the fight against NCDs. And I say the cabinet lead because, as has been just said, it's an all of cabinet fight against NCDs. So please help me welcome Dr. McIntyre, Minister McIntyre, to the podium, while he will give us an overview of the health situation in Dominica. And I would like to ask Minister and Dr. Etienne to maybe move to these two empty chairs on the front row so that they can view the podium. Minister.
Thank you very much. Let me recognize Honorable Ian Douglas, the Minister for Trade, and our Director, Dr. Etienne, our Assistant Director, Dr. Barbosa, and all the heads and directors of PAHO here, the press. Pleasant good morning to everyone. So I will try my very best to see how I can put everything within the time allotted to me. So basically, here you can see a little bit about Dominica. It's really a small island developing state. Our population, as you can see, 71,990. And we depend heavily on services. That's about 56%. And tourism, which accounts for 14% of our GDP. And obviously 30% of employment takes place within the tourism industry. Agriculture, well, that and manufacturing collectively accounts for 18% of our GDP, and we're an open market system, and we have a few trade partners, and price stability in Dominica has been supported because we have the Eastern Caribbean currency, that's 7 Eastern Caribbean countries, the Eastern Caribbean Central Bank, and that's since 1976, and that allows us a bit of price stability in Dominica. Okay, so politically, it's a unicameral legislature. All that means really it's a one chamber legislature as opposed to other countries where you might have a House of Senate, a House of Representatives, but it's a one legislative chamber here. And 21 constituencies, we have elections every 5 years. It does not necessarily mean that that 5 years would have to elapse. It can be called before that, but generally speaking, it's within 5 years. The Dominica Labour Party holds 18 out of the 21 seats, and we form the majority, so we're the government presently. And our next national election will be held before December 2024. Our last one was in December 6, 2019. So if you count 5 years from then, it will be 2024. But as I said, not necessarily 5 years. It could be held before, as you've seen in other sister Caribbean islands. Our major issues, obviously natural disasters. Since 1950, we've had so many different natural disaster events. And 15 of them, quite a few. We have Dean, we had Maria, we had Erica, and Hurricane David was really the first terrible one in 1979. And, but Erica, which was really a hurricane, it was actually a tropical storm, and that caused severe damage, estimated 96% of our GDP was lost. And then Hurricane Maria, which was in 1917, September, that was our worst disaster. And the damage estimated US $1.3 billion, getting rid of 226% of our GDP. And as a matter of fact, 95% of our housing stock was lost. So that was, most of you would have recognized where we are now compared to 2017. And that took a lot of effort and that took the initiative of our Prime Minister, and the government had to invest a lot of energy and time and resources in getting the country back to where it was. As a matter of fact, it cost us almost $300 million. That included whether it's clearing up the place, whether it's the dredging of the rivers. And from since then, that was when the Prime Minister said that Dominica would become the first climate resilient country. And we've been working on that really hard from since then. And you will recognize it all over. Even on your way to Roseau, you'll see the street lights, you'll see the solar panels, you'll see the windmills, our slope stabilizations, our dredging of our rivers, whether it's in terms of our geothermal initiatives, and just our building codes and all our resilient structures that we're building since then. So we've really taken up the mantle together with the Prime Minister that we're going to become the first climate resilient country in the world. In terms of our economy, our GDP of US $548.41 million, and before COVID, obviously, our growth rate was 7.5% up till 2019. And the IMF estimated negative GDP growth. Obviously, that's because of COVID. But with recovery taking place in 2021 to 2023, you can see 3.4, 7.9, 5.9 respectively. So we're on the upward trend, which is good news for us. But obviously, after Hurricane Maria and with the COVID-19, there was this negative that you could have seen, but we are getting back on track, and that's good news for us. In terms of our population, 29% lives in our rural areas. Extreme poverty just at 3.1%, that was in 2009, and 11.5% vulnerable to extreme poverty. We have a high Human Development Index, which is 94 out of 189 countries. And in terms, we rank 94th of 174 countries, the World Bank Human Capital Index, and 35th highest in 144 United Nations Human Asset Index. On health preparedness, we should do much better. We're 172 out of 195. In terms of our Sustainable Development Goals, well, we have adopted UN SDGs, which came into effect in January 1, 2016. And then we are still committed to achieving all the SDGs by 2030, despite the many setbacks of Hurricane Maria and the COVID-19. And obviously, together with the Caribbean community, set a core of SDG targets and indicators. And our National Resilient Development Strategy for 2019 to 2030 is aligned with all of the UN SDGs. In terms of our health profile, you can see what our life expectancies. The total is 77.5, our males 74.6, female 80.7. Obviously, the females are much higher. Infant mortality rate, this is something that concerns us, and we have to make some significant strides and interventions to correct this. Also in our perinatal mortality. I saw the 2021, and they were lower than what they are presently, but nonetheless, these are areas that we really have to put some serious effort, energy, and resources to get this done as well. In terms of maternal mortality, well, that's no deaths since the 2 deaths in 2016. Our accrued death rate, you can see 9. All these are sources from the Ministry of Health. And our top 5 causes of death, you can see ischemic heart disease, cerebrovascular disease, hypertensive disease, diabetes, and malignant prostate neoplasms. And obviously that's 80% of all deaths in Dominica, which brings us to the point of the non-communicable diseases, which is definitely a major issue for us. And over the past few days, these are the things that we've been discussing, and these are the areas that we really want to target we've done so in the past few days, and that's where the discussion continues. Okay, our hospitals, the Dominica China Friendship Hospital, and we have 2 other hospitals. That's the Marigot Hospital, that's in the Northeastern District, soon to be open, most probably within the next 2 to 3 months. We also have the Regional Armour Hospital in Portsmouth, and well, during the COVID surge, we also opened St. James Hospital, that's also in Portsmouth, but now we no longer have any patients in Portsmouth for the COVID case, so we had to close St. James. So we still left the Dominica China Friendship Hospital, the Marigot Hospital, and the Portsmouth Hospital. And all these come under the Dominica Hospital Authority, which We went to Parliament in August of 2021 to have the authority set up. Health centers, 47. Some of these are primary and some of these are type 3 and type 1. We have 7 health districts, so each of these health districts would have a type 3, and we have many of the type 1 health centers in the different 7 health districts. Nurses per 10,000 population, 11.1. And obviously that has been significantly impacted by the nurse migration, particularly after Hurricane Maria, and to a large extent during COVID-19. But that's not unique to Dominica. It's an issue all over the Caribbean, I guess all over the world, nursing migration. But what we have been doing since then is our All Saints University, which graduates nurses as well, and our Dominica State College, which we have our medical section, the medical faculty, that also graduates nurses as well. So as a matter of fact, last year we had a total graduation of 42 nurses, both from the All Saints University and the Dominica State College, but we want to beef this up and we intend to bring the numbers higher. So for now, we also rely quite a bit on having nurses come from Cuba. Then in terms of physicians, per 10,000, 38.8. Quite a bit of our doctors are trained from in Cuba, to a certain extent China as well, University of the West Indies also, and we also get quite a bit of assistance from the Cuban government in terms of medical personnel to assist us in our healthcare system. Dentists, that's in the public sector, not the private, that's 1.2 per the 10,000. In terms of community health workers, 2 cohorts of community health workers have been trained since 2018, and all that's done with the assistance of PAHO. And I must say they really came to the forefront. They were the foot soldiers in our fight against COVID-19. And they've been doing an excellent job getting out into the community. They are really the first line of contact that the villagers, the citizens, the people in the community have with the healthcare system. So these community health workers have served us pretty well. And we are pleased and we thank PAHO for all the interventions in that regard. 2 cohorts were trained. Total health expenditure, you can see in terms of percentage, that is 3.4 in public, 1.6 in the private. And that's, that we have to be adjusted. Yesterday when Dr. Amalia spoke about the amount of the GDP, percentage GDP that's spent on primary healthcare. And Dr. Ashby said it was 7.9. But that also didn't include all the spendings on infrastructure, because as you know, we built 12 of these health and wellness centers. We have 3 more to go, but that wasn't part of the 7.9. So if you were to ask me, I think it would be much more than this, but obviously we get the point that quite a bit has to be invested in primary healthcare for us to achieve the sort of health services that we want for our citizens of the country. Out-of-pocket expenditure, you see 29.1, that's percentage of total health. All these sources are from the PAHO core indicators. In terms of our national planning tools, the National Resilience Development Strategy 2018 to 2030, that's one of the tools. The Climate Resilience and Recovery Plan, CRRP, that's from 2020 to 2030, that's one of the other planning tools. Our National Health Strategic Plan 2016-2019, but now that you're here, obviously you're helping us to get a new plan and the blueprint for a new plan, it's, which we're going to be very grateful for, because that was up till 2019. In terms of our national plans, they are all aligned with the United Nations Sustainable Development Goals, Sustainable Health Agenda for the Americas, and also the Multi-Country Cooperation Strategy for Barbados and Eastern Caribbean countries, and also PAHO Strategic Plan and the PAHO Biennial Work Plan for Dominica. I must say a lot of these meetings that we've been having regarding the BWP for Dominica, they've been very fruitful, and we're grateful for Dr. Gibre and his staff from Barbados, who engage us very frequently at our BWP meetings. And in the mere fact that there was COVID, obviously there were some little limitations in achieving some of the goals that we intended to, but there were some low-lying fruits that we managed to have achieved, and that meant quite a bit for us, and we're very grateful for the Barbados OECS team who helped us in our BWP planning for Dominica. In terms of our National Resilience Development Strategy, it outlines a roadmap to resilience by 2030 in keeping with the 2030 agenda, focusing on the 5 Ps. That's prosperity, planet, peace, partnership, and people. And then our Climate Resilience and Recovery Plan which was developed in 2020 by the Commonwealth of Dominica under the leadership of the Climate Resilience Execution Agency for Dominica, that is CREED. Throughout the presentations, you'll see a lot of times I'll be referring to the climate aspect and the resilience aspect, but all that is part of the multi-sectoral approach that we are going to adopt to develop as a small island developing state, because we realize that health cannot develop in isolation. All the other areas must be part of the whole program. And we have to consider even other ministries such as the housing ministry. These are all social determinants of health. So all this is part. And the mere fact that we engage in all these resilient structures and even our health centers, that is all part of the bigger picture and the comprehensive development of a small island developing state. Okay, well, capacity building and human resource development and improving health services delivery from an integral component of the NRDS resilience framework. And it calls for to operate a responsive, well-furnished health system that is technically current, staffed with the best trained medical personnel. I've mentioned it before, meritocracy has to be part of it. And very important, we need the correct people in the correct places. Develop physical plans that are safe and built to environmentally informed standards. Every now and then you will see me refer to the environmentally informed standards. We have, after Hurricane Maria, we've learned our lesson pretty well, and we want to build better and stronger. And that's also not just in terms of infrastructure, but a resilient healthcare system as well. Develop and manage a social service delivery system that is internally robust and externally transparent and must be gender sensitive, very important for us as well. And have a response mechanism informed by an up-to-date data management system. Over the past few days, we've been having lots of meetings with the information experts, and we've recognized that this is one of our limiting factors in terms of how do we integrate our primary and our secondary healthcare system. And it goes beyond just the data and information related to the patient or the individual. It's also the data that we can use to guide our policy decisions as a government. So it's more than just individual data that we want to collect. And in terms, and obviously that's what's going to guide our sound policies and a well-aligned program framework to meet the needs of the individuals, families, and communities in Dominica. Okay, in terms of our health focus, obviously you can see our main 7 of them would be the service delivery, our health workforce, that's important to us, the information system, which I just mentioned recently, and that comes at a very opportune time because now in the OECS, we have a $8.2 million US dollars for the health information system for the OECS countries, which Dominica is part of, and we've had lots of meetings, and the consultants have been here with us, and we really look forward to developing a very efficient health information system. So that would help us in the delivery of a much better health care. Then obviously to access the essential medicine, that's important. Financing, in a small island developing state, financing is always an issue, and this is one of our main focuses as well. How do we make it sustainable in terms of financing? Leadership and governance, that's where the Ministry of Health comes in, and that must be strong, and I put my commitment to that as well. And obviously community participation. We have recognized that even during the COVID pandemic, to a certain extent, the community participation, we had a little issue in getting the community on board, whether it's in terms of vaccination or whether it's just in terms of adherence to the guidelines and the protocols. And we're going to target this very much, and that just exemplifies the multi-sectoral aspect of it, in that the Ministry of Governance, the Ministry of Social Services, all of our different local government groups, whether it's the village councils, and to be part of the whole health development system that we want to put to. So as Dr. Etienne has spoke about yesterday, in days gone by, we had a very strong village health groups. So that is where the community participation is of paramount importance, and we want to engage the community once again. That's the only way I think we can really get to where we want to do, that the community must be part of it. We could be planning and we could be building all the structures, but without the community as part of it, I'm not sure that we'll really realize what we want to do. So the community participation is of paramount importance to us. In terms of our areas for national policy considerations, strengthening the health legislation, We've heard this mentioned quite a few times before, where there's a legislation regarding tobacco, where there's legislation regarding sugar-sweetened beverages, and all those different things. So, and that's an important part, the primary healthcare, of course, also, and the human resource for health. Or human resource is a very, very important part. Let alone doctors and nurses, just all the other support staff and personnel that are associated and related to health. A sustainable health facilities, that's important to us. The Smart Hospital Initiative, our hospital in Portsmouth, that's one of the initiatives that was done. And besides that, also the other climate, the other smart health centers, that's Lap Lane, and that's Grand Bay, and Trafalgar, which is in my constituency. All these were smart health centers, and all that was done with the assistance from PAHO. That's important to us. And to drive the climate resilience and health agenda, and to strengthen information system, which I mentioned earlier. It will keep coming up every now and then, the information system, and that's with the digitalization of the health data and encourage data sharing to inform plans of other development sectors. But this digitalization in health, it's not just limited to health. The entire country is on a digitalization program, so it's beyond health. It's really a multi-sectoral part, but obviously we're going to benefit significantly from that. And obviously climate change and health. So these are the areas for national policy considerations. These are the 6 areas that we have to consider significantly in terms of our national policy. And obviously strengthening laboratory capacity, that's very important, and develop warning signs for climate-sensitive diseases. I guess in our case, it would be more things such as dengue, and vector-borne diseases. The others might not be so specific to us, such as Lyme and malaria, etc. But in our case, it would be vector-borne disease, and dengue would be the one that comes to mind. Our last outbreak was in 2019. Luckily for us, during the COVID pandemic, we didn't have an outbreak of dengue. We have to increase the outreach and health campaigns and provide opportunities to build in capacity of health services personnel, surveillance, that's important, environmental monitoring, vector control, and psychosocial support. We also to strengthen our solid waste management systems and technologies. Yesterday when Dr. Etienne spoke about that's 20, 30 years ago, in terms of our solid waste management, this was definitely an issue. This is why the disease profile was much different in terms of diarrhea and rehydration, as opposed to now, where we more have obesity and our NCDs. But so solid waste management, we've done quite a bit. Our government actually launched a program to get rid of all pit latrines, and I see other Caribbean islands have adopted that as well. So that has helped us quite a bit in terms of our health and the health of our people. Integrated health services delivery of the private sector in provision of affordable health care. And healthcare, as you know, must be affordable. The biggest issue we can have is if people were to be out of pocket at the point of care. So, yep. All right, situations related to communicable disease and environmental determinants of health. Presently, low incidence of TB, just 12 suspected cases in 2020. 0.6% prevalence of HIV, that means 84% know their status. Dengue outbreak, as I said, was in the last one in 2019. And obviously, resistant pneumonia and E. coli in 2021. In terms of our achievements, we got certified for in eradication of mother-to-child transmission of HIV and syphilis in 2021, and all that we have to thank PAHO. There are a lot of assistance in getting there. The other English-speaking Caribbean islands would be St. Kitts and Nevis, Anguilla, Antigua and Barbados, and also Montserrat. Obviously, the U.S. Virgin Islands, Cuba, Chile, and quite a few other in the Americas as well. A lab capacity installed for nearby antimicrobial resistance detection. That is important as well, and also lab capacity installed for HIV, viral loads, multi-drug resistant TB detection. With our gene expert, all that came from PAHO as well. And our global fund grant for HIV TB approved, that was from 2022 to 2024. In terms of our challenges here, guidance documents need updating, particularly in communicable disease surveillance manual, last updated in 2010. So we're working on this as well as the surveillance for dengue, influenza, severely impacted due to COVID-19. We also have to work on this as well. The public health surveillance largely is paper-based, and we've discussed that at length. And with the new digital economy, we will be addressing this largely paper-based public health surveillance system. Yesterday, you heard Dr. Ahmed mention the amount of indicators and the amount of paperwork that it's really a tedious job, and it's not the most efficient. So I think with the digitalization, we will definitely see some benefits there. In terms of epidemiology department, it's understaffed and overburdened. Presently, we also have a consultant from PAHO who is with our epidemiology department, and that makes a big difference to help Dr. Ahmed, our local epidemiologist. We have some serious gaps in care and retention for treatment of people living with HIV, which was amplified during the COVID-19 pandemic as well. Now, but as our laboratory is well equipped with inbuilt redundancy, over the past couple of years, every now and then there will be something breaking down at our national labs. But we built an redundancy, and this hasn't happened in the past 2 years. So whenever just one machine may be down, the other is functional, and that I'm really pleased that we've been able to build redundancy. In terms of health information system support via the USG funds, that is good news for us. And training to use capacity of the molecular lab for surveillance of other diseases, that's also great news for us. In terms of the global outbreak alternate and response, that is advisor to country for 16 weeks to support the EPI. And that is good news for us. The Global Outbreak Alert and Response Network advisor that would definitely help us quite a bit. In terms of the COVID-19 data utilization, would alleviate the data entry. That helped quite a bit. We had quite a bit of persons. Ministry of Governance did provide quite a bit of persons, and that helped us to digitalize and alleviate the data entry issues. In terms of procurement of lab supplies for HIV, TB, STIs, and that using the USG funds. Okay, situations and achievements. So health expenditure, 6.6% of GDP. This, I will have a discussion with my boss regarding this as well, because we know this figure has to be adjusted. And in terms of our health-adjusted life expectancy, which really means full health, not hampered by any disease or disabling, is 63.1%. Achievements, information system for health, maturity assessment carried out. That was carried out, so that's good news for us. In terms of challenges and the future possibilities, essential service of public health assessment, for one. Human resource for health policy, strategy and plan to be developed. That is very important. Legislation for health protection scheme review, and also the health information system support via USG funds. So every now and then the health information system keeps coming up again. In terms of achievements, well, our profile was completed in 2020 as part of the Caribbean Action Plan, and that present evidence on climate hazards, health vulnerabilities, health impacts, and progress to date in health sector. Develop a climate resilient health system. Every now and then, climate resilient health system will be coming up because, as I said, we're going to build better and stronger, and it's going to be a holistic approach, a multi-sectoral approach. Every ministry in the government system, as Dr. Etienne mentioned earlier, whether it's the Ministry of Trade, whether it's the Ministry of Housing, and all the other social determinants, we have come to recognize that it has to be a multi-sectoral approach for it to be sustainable. And that is why every now and then the climate aspect will be mentioned, the digitalization will be mentioned, the housing will be mentioned, etc. Highest priority climate sensitive health risks identified by DOMICA would include 1, water security and safety, 2, food security and safety, vector-borne diseases, as I mentioned earlier, non-communicable diseases, definitely that's a big one, maybe it should have been higher up, mental, psychosocial health, and health impacts of extreme weather events. In terms of climate change and health, the next steps, that's to develop and implement a health and climate change strategy plan. 2, strengthen the integrated risk surveillance and early warning systems. Address barriers to accessing international climate change finance to support health adaptation. That's a very important one for a small island developing state. As you know, financing is important for the sustainability. And the concept note for submission to the Green Climate Fund being developed jointly by the Ministries of Health, Agriculture, Education, and it's supported by PAHO, FAO, and UNICEF, Integrated Climate Adaptation and Resilience in Dominica. So as you can see, the ministries again coming together, whether it's health, whether it's agriculture, whether it's education, and that just shows you I keep stressing the multi-sectoral aspect of development of a small island developing state. We build a climate resilient healthcare facilities that I mentioned earlier. I told you about the smarting of Laplane Health Center, Granby Health Center, Trafalgar Health Center, Massac Health Center, also the smarting of the Portsmouth Hospital. And it's more than just smarting in terms of the physical structure and the climate resilience. It also includes in terms of the sensor taps that we use in all of these sensors, in all of these facilities, such that we can conserve on water, because all of these things, in terms of the ventilation, in terms of the access of the public to these centers. So quite a few things have been taken into account when we talk about smarting of these hospitals and health facilities. In terms of the health workforce development and to develop capacities in communities, educational institutions, and technical support agencies in areas such as surveillance, environmental impact assessment, psychological support, post-disasters, etc. The Ministry of Education is well on board with quite a few of these things. We've had extensive discussions with the Ministry of Education as a matter of our school food nutrition program. And if we were to attack NCDs, obviously it starts from the school level in terms of getting the mentality of the children on board. And the children bring the message back to the parents at home. And also that's where the good nutritional habits start. And we have a good food nutritional program. The Prime Minister mentioned it repeatedly. And that's when Minister of Agriculture comes in terms of eating what we grow and grow what we eat and the healthy foods. So it's a combined and comprehensive approach. Okay, this one might be a little, that was done a couple of days ago, so it might be a little bit off. But so far we still at 63 deaths. We've just about 45.1% of the population had their first dose of the vaccine, and second dose 41.7%. Over this week, we have a very extensive program, and we intend to see how we can get our numbers to get up to a more acceptable form, because we were actually the first to have vaccines in the English-speaking Caribbean. That was through the intervention of our Honorable Prime Minister and Prime Minister Modi of India. We got the AstraZeneca, and in typical Caribbean camaraderie, we also shared with quite a few of our sister islands, but 42%, we definitely want to be higher than this. And this week, well, not just for Dominica, the entire region and the Americas, I think we all want to be higher than where we are presently. Okay, COVID-19, our achievements, well, the country's capacity is strengthened throughout the 10 pillars of the Strategic Preparedness and Response Plan. We got a lot of assistance from PAHO for this, whether it's in terms of our command and control center and management, in terms of our surveillance and diagnosis, in terms of our vaccine delivery, and also in terms of our health system and emergency response. As a matter of fact, we had to set up the COVID care complex, because at one time we had 500 inpatients of COVID, close to 500 actually. So we had to set up a brand new hospital in Portsmouth. That took us about a week. And we had to transfer almost 120 of our staff. So it was a complete new staff structure. We had to renovate about 6 or 7 buildings. So all that came under our health system and emergency response. In terms of community disease control, PAHO helped us quite a bit here. And in terms of infection control, you might have seen quite a few of our war stations all over the country. And in terms of clinical guidelines, we got quite a bit of assistance from PAHO in all of these ones as well. The main objective, obviously, was to save lives, protect health workers, and suppress the spread of the virus. Capacity is strengthened for surveillance contact tracing through the provision of IT equipment. We got lots of equipment. We had a complete command center at the Dominica China Friendship Hospital that was financed by PAHO, and that helped us quite a bit in our COVID-19 response. In terms of training providing use of the software, the mathematical models for surveillance, and the short-term forecasting of cases, even the WHO guidelines for ICD-10 coding, and mortality, and then the laboratory capacity strengthened for molecular diagnosis, and through training of laboratory personnel and provision of laboratory reagents, equipment, and supplies. Quite a bit of our equipment, our supplies, whether it's our rapid antigen tests, whether it's our PCR testing, all the equipment and the supplies, we are grateful for that as well, and that assisted us quite a bit in our fight against COVID-19. Infection prevention and control measures, that was strengthened through training of the healthcare personnel. We did quite a bit of training, and obviously all the PPEs that were provided, and assessment of the IPC protocols of health facilities and installation of water, sanitation, and hygiene facilities, which I mentioned earlier at all. We had quite a bit done in the capital and even out in the rural areas as well. All the wash stations were set up. In terms of achievements, the emergency medical team developed to provide training and development of protocols for the management. There were quite a bit of training did go on, and we are very grateful for PAHO, because a lot of the training, whether it was virtually and some of them done locally face-to-face, but the training did mean quite a bit to us. And that was one of our major parts of just retraining our healthcare workers. In terms of the assessment of our oxygen plant, we got assistance there from PAHO as well. And but we're going to, and we actually expect procurement of some parts for our oxygen plant to bring it back to full capacity, and also we're procuring a new oxygen plant as well. The biomedical engineer did come here. He was from Spain, if I'm not mistaken, and we're grateful for that. A very good intervention here. We also got oxygen tanks locally, and to meet the increased demand for oxygen. In terms of medical equipment, including oxygen concentrators, defibrillators, ventilators, all our vital sign monitors, etc. This was provided. We had some friends from PAHO as well, and some other friendly governments. The People's Republic of China was very helpful with us and to us, and the Bolivarian Republic of Venezuela and Cuba as well. In terms of technical support and guidance, that was provided in support of development of the COVID-19 National Vaccination and Deployment Plan and the vaccine introduction readiness, and also the facilitation of delivery of vaccines through the COVAX facility. So these, we're very grateful for all of these, and these definitely help us in our fight against COVID-19. In terms of public health emergencies, the achievements, as a matter of fact, just recently, our multi-hazard disaster management plan that was passed through cabinet, so that's good news for us. And also in terms of strengthening human resource capacity for response to disasters and health emergency through the training of a cadre of personnel in mass casualty management, emergency care and treatment, and incident command systems. All this was done. And we have a training cadre of the healthcare workers, which I mentioned earlier, the two batches that have graduated. These are our foot soldiers in the Ministry of Health, the persons that the community get their first contact with. And as I said earlier, they've done an excellent job in helping us to fight this COVID, not just COVID-19 in general, but basically they have been out there, and they're playing a very significant role in our primary healthcare system. And obviously we do have challenges, we have competing priorities. COVID-19 response took center stage, so other programs suffered, and that's what we all mentioned yesterday at the launch of our vaccination week in the Americas. Lots of our staff had to be repositioned in terms of fighting COVID-19, and obviously our immunization numbers did drop because our staff were repositioned, and also because of the social distancing and restrictive measures. So that sort of limited the ability for people to have their vaccinations, their immunization of the kids. So that definitely was a challenge for us, the competing priorities. In terms of the national strain placed on the health systems, and which requires reorganization, that definitely was an issue. That was a challenge. It still remains a challenge. And insufficient human resource. Personnel moved from one area to health services in focus on COVID-19, which I just mentioned. And Dominica, being a small island development state, is therefore very vulnerable to extreme weather events such as hurricanes and tropical storms, which we may not have direct control over, but obviously we can adjust lifestyles to mitigate quite a bit of the effects of those climate events. So these are the challenges that we have to face, and this is why we're moving in the direction of being the first climate resilient country, and that's why we're doing all of these different interventions to be the first climate resilient country. Now this is the, yesterday we had a very good symposium on primary healthcare and non-communicable diseases. And this is, as the Prime Minister keeps saying, this might be one of the most single threats to our socioeconomic development as a small island developing state, let alone the amount we spend on the management of these cases, but it's also the indirect effect of loss of productive days due to illness. And the sad part about this is if we were to use hypertension, for instance, where some of the four maybe major complications, which would be heart attack, stroke, renal failure, heart failure, interestingly enough, two of these, which is renal failure and heart failure, are preventable because in any case, age in itself is a predisposing factor for a stroke or heart attack. But renal failure and heart failure, these are those that we can deal with, but sadly enough, we lose quite a bit of working days and productive days due to people being ill from these complications of these non-communicable diseases. But anyway, 56.4% of men, and you can see 67.5%, although Dr. Esprey had some different figures yesterday, but nonetheless, it is still alarming. And you can see the prevalence of diabetes in men and women. This is definitely an issue for us. And you can see hypertension at 32.1%. Here is our mortality rate, 520.3 per 100,000 population. 14 years, before 14 years, you can see those who first use drugs before 14 years. This is definitely concerning to us. And the percentage who actually attempt suicide one or more times during the past 12 months, 15.3%. So these are, for NCDs, this is definitely an issue. In terms of achievements, you have the development of a school nutrition policy and school standards, thus providing an enabling environment to promote healthy diets and good nutrition in children. We are definitely working very hard in the Ministry of Education to make sure that this is carried out and carried out in a proper manner, a very effective manner, because we know if we can target the school children, then we get into a level of sustainability. That's the only way it can be sustained. We have to get into the minds of the school children who bring the message back home. And then we have preventative food care program, which is strengthened at the primary healthcare centers and expanded community include nail salons. And Dr. Esprey, our Director of Primary Healthcare, is one of the leaders in that part, rightly so and suitably so as well. Implementation of the health promotion and tobacco cessation initiatives for smoking prevention and cessation. As a matter of fact, in the next couple of weeks, we'll be bringing something to Cabinet and later down something to Parliament regarding the cigarette smoking and advertisements in terms of the labeling as well, and try to have Dominica smoke-free as possible. So we're working very hard on those ones. And that's an excellent example, as Dr. Etienne spoke earlier, in terms of legislation and how it can help in the comprehensive approach to health. We also, Dominica joined the HATS in the Americas initiative. As a matter of fact, we intend to launch this in June, and we're really, really excited about this because this targets also our NCDs, and also in terms of updating our treatment protocols. This is all part of the HATS program, and we're very excited about this program, which we want to launch in June. As a matter of fact, the sensitization of the healthcare workers and the training of the trainers, that will be taking place next month. And also to develop a standard operating procedures for cervical cancer as well. In terms of challenges, we have the deployment of human resources to the management of COVID-19. I've spoken about this before, which obviously delaying the implementation of the NCD activities. In truth and in fact, during the COVID-19, our regular clinics for the NCDs was significantly affected. And we actually saw quite a few of the diabetic feet. So that was an issue. So you could definitely see how COVID affected our clinics for the NCDs. In terms of a weak health information system, it came to the forefront yesterday again, and so these are critical challenges to implement the HATS technical package. So that just shows you how everything has to be done in tandem together, whether it's the health information system together with the HATS, because obviously there must be documentation and there must be records. And as I said earlier, not just of the individuals and the patients, but also to guide our policy decisions. Limited participation in regional mental health initiatives in that building individual and community resilience. So that's why I mentioned earlier in terms of getting the community on board We are fully aware of that limitation, and we want to tackle this head-on as well. Future possibilities, as I mentioned earlier, a smoke-free Dominica, drafting instructions for the development of the tobacco control legislation. This is presently in the with the Attorney General chambers. Self-care for the LNCDs, chronic disease self-management program, expanded to be led by the faith-based organization. Standard operating procedures for cancers, standardized treatment care for most common cancers, cervical, breast, and prostate cancers. Cardiovascular management in primary health care, that's where HATS come in, the HATS technical package comes in, and then the expand human resource to manage psychological and practical problems, inventing problem management plus. In terms of maternal and child health for under 5 infant and neonatal mortality rates in Dominica, this has been a concern for us, as I mentioned earlier. And between 2028, the mortality rates have more than doubled. And as I said, in 2021, we saw a slight decrease, but obviously we have to do much more than that. More than 6% of deaths occurred during the neonatal period. And that is sources from the United Nations Interagency Group. The population is an aging population, 13% being older than 60. That means we have a less productive population, and we have to care for those. The Prime Minister keeps making mention to the fact that we have to build our population, and we're giving the challenge to our young people on that one. But yes, so that's our population. That's how it is. It's an aging population, 13% being older than 60 years. And the number is steadily increasing. So you can as well imagine the problems that comes with this as well. The achievements, we've had the introduction of the perinatal information system, introduction of the HPV vaccine. As I mentioned yesterday, we had a 92% coverage in adolescents. Introduction of the COVID-19 vaccine, the cold chain, the capacity development, data entry clerks, and vaccine animators. These animators did a pretty good job, I must confess, in getting out into the community, into the homes, and interviewing the people and having a real one-on-one, face-to-face discussion with people regarding the vaccines. And the community outreach activities were extensive as well. And elimination of the mother-to-child transmission of HIV and syphilis, which we achieved last year. And that meant quite a bit to us as well. Systems, that is also part of the digital economy and digitalization of health, which has been discussed repeatedly, and but that is being worked on with the 8.2 million US, as I mentioned earlier, and obviously the limited staff burnout for the EPI program, that they're only humans. They had lots of things doing, whether it's in terms of managing COVID, in terms of the normal EPI programs, so that is understandable. Our next steps, that would be strengthening the ASAVI surveillance and implementing the 10 steps of successful breastfeeding, the Cervical Baby-Friendly Hospital Initiative, and the rollout of the EIR, attending the membership to the age-friendly cities, decade of healthy aging, and conducting a perinatal review. So this is, in a nutshell, I tried to squeeze everything together so you can get a general view of the healthcare system. And obviously, through all of these areas that I mentioned and I spoke about, PAHO has been at the forefront with us in terms of intervention and assistance, whether it's in terms of supplies, whether it's technical, just the guidance, and that my entire presentation was riddled with PAHO's intervention, I must confess, and that we're very grateful for. So thank you very much. That's in a nutshell the healthcare system here, and the opportunities for PAHO still remain, lots of opportunities to assist us there, and we look forward really working together to see if we can provide the healthcare system that would be best for Dominica, and we want to use Dominica as an example for the rest of the Caribbean, and we're very optimistic, and we're positive, obviously, in terms of the commitment and the leadership. You have my commitment, you have my leadership. And the government on a whole, really, everybody in the ministries, all the different ministries, are really excited about this new thing. So it seems like health might just be the ministry that's going to just drag the rest of the government together. And I think where else to start but with health? So I think we're in a good stage and a good footage. Yeah.
Thank you, Minister. We are running a little bit late, so we have time maybe for 2 questions to the Minister or any of the PWRs. Ian, wait for the mic.
Thank you very much, Minister, for the presentation. Thorough, complete, as we would anticipate. I was particularly impressed by the commitment that you made to investing more in health financing. And in particular, I'm wondering if we know what the level of investment is, the percentage of investment on the first level of care. And as you know, we have this target of 30% investment in the first level of care. I'm wondering if that is something that you see as achievable here and sustainable.
In terms, well, I think it's achievable, and with discussions I've had with the Prime Minister, he's definitely online in terms of primary. Healthcare is very, very dear to everyone within the government system. So in terms of having the initiative and the commitment, yes, I think we can head for this. In terms of still sustainability, obviously, we have to see how times go along, and we'll have to be obviously pragmatic in our approach. But definitely, we intend, and I intend to drive that point really strongly home with the Honourable Prime Minister to see how we can get to that percentage that you mentioned. And I think we can pull it off. And as I said, it's the entire government is behind this. We've recognized that we need a healthy population to get us where we want to get in terms of development as a country. And what a better place to invest but in the health of the people. So I definitely think that can be done. As I said, we'll be pragmatic. Obviously, we know all the different natural disasters that can take place, but God forbid these ones, we will definitely try to achieve this. And I think it's something that we can do. Yeah.
Please introduce yourselves, because the Minister doesn't know us all, and also we're looking up. I'll give to Karen first.
Thank you very much. I'm Karen Lewis-Bell, the PAHO WHO representative in Suriname. And Minister, I would really like to congratulate you on a very comprehensive report, and more importantly, to congratulate you on your achievements as being certified as eliminating maternal mother-to-child transmission of HIV and syphilis. You alluded to the concerns regarding your increase. I think it was like a 3-fold increase in your infant mortality rate between 2018 and 2019. And you indicated that some 60% of your under 5 deaths were in the neonatal period. I also noted that you have implemented a SIP+, and you did allude to strengthen your information systems for health. Minister, I just wanted to ask, what specific, are you able to share with us any additional strategies or plans you have for strengthening your maternal and newborn health, specifically neonatal health?
Okay, in terms, it's something we've observed over the past few years. And as a matter of fact, just recently we had some consultants here, and they did go through this together with us. So in terms, one for sure, in terms of the data, we were a little concerned and we were wondering whether actually the data was correct. But actually we went through it, and then we were a little concerned that whether it was really an issue with the data as opposed to really some systemic organic issues that we had. But nonetheless, the figures are there and we have to deal with it. So there's no running away and hiding away from it. In terms of specific stuff that we have done, we have actually engaged the neonatal department and all the pediatrics department at the hospitals. There's a very big conference coming up very soon to deal with all the specifics related to this. So as to the specific part of it, we haven't got a concrete idea as to the different areas we're going to handle, but consultations have started, and we have begun the interventions will be taking place very shortly regarding those ones there. But it's something that concerns us, and we are fully aware of it, and we are not going to sleep on this one because this means a lot to us. And but the consultations have started going on, and we should be expecting a paper on this very soon. So we can also provide some of this to you even later on.
Maureen.
Good morning, Minister. Thank you. My name is Noreen Jack, and I'm the PAHO WHO representative in Belize. Thank you for your comprehensive presentation. My question relates to community participation involvement. I heard the passion in your voice related to strengthening community participation and the restoration of like local health committees and village health committees. I really would like to know what are the key strategies that you are considering, and also what do you think are some of the areas that PAHO can support you? What sort of guidance documents to enable the strengthening of community participation and involvement in a real way to strengthen primary health care? Thank you.
Okay, so this means a lot to us, and we are fully aware that for it to be sustainable, the community must be part of it. So the two areas that we have identified really is the local government areas. The way it's set up, we have the different village councils in all the different villages. And then we have the chairman and you have the executives of all these village councils. So we want to involve these village councils so we can have village health groups as well. So we'll have a health group being part of the village council. So the village council is not just responsible for different little infrastructural activities going on within the village, and not only just for the sporting activities, but also to have village health groups as part of the village council. And so that's part of the local government. Apart from that, also the church groups. So we have all the different church groups, and there must be different health groups within these church groups. So it's within the village councils, within the church groups, and within all the other NGOs. We want to bring all of them together and to not just have them in name, but they have to be functional in that regard. So they have regular meetings and outreach programs, and they get involved. And even also the different sporting groups must be part of it as well. So it's all the sporting groups, it's all the village council groups, it's all the church groups, and we're going to engage all of them. We had it in the past. It's nothing new to us, but we just have to re-energize the whole community aspect of it. And I think if we can do that, we're in a better position. So we have plans for all of these groups to get together.
Thank you very much, Minister. Maureen Birmingham, the representative in Haiti. Again, I echo my colleagues in appreciating very much your presentation, not only very comprehensive, but very transparent in what your achievements are, but also what the challenges are here. So thank you for that. We have a lot to learn from Dominica. I had actually two questions if I'm allowed, but the first question is about your human resources for health. I was very impressed by the struggles you're having basically with the migration issue, and really of your human resources for health, and particularly that you have 3 times more nurses than doctors. I'm just wondering what we can learn from the Dominica experience in terms of, have you found measures to stem this migration? You mentioned you're trying to increase the production of nurses, and you're also recruiting some Cuban nurses, but what can we learn from you in terms of perhaps measures you have found that could help stem this? I think all the countries are working and struggling with this issue, so it would be great to hear from you. And the second thing, very quickly, is to what extent is the private sector an actor here, and how does that work in terms of are there private-public partnerships, or are they subject to regulation, or if you could just make a comment about that. Thank you very much, Minister.
Right, so as I said initially, obviously the issue of nursing migration is not just unique to Dominica, it's a worldwide issue. And nurses migrate from one country to the other, whether it's for, some of it may be for greener pastures, it may be financial reasons, some of it is just maybe from an academic, intellectual point of view, people want to develop further their own personal stuff, and there are other different reasons, personal reasons why people migrate. But what we've done is, in terms of, obviously we have to increase our graduating nurses. So that we've done in terms of our Faculty of Health at the Dominica State College. So what helps there, it's absolutely free tuition. No one pays at the Dominica State College. And that we've seen quite a bit. That has helped us in terms of attracting more of the younger people into the Faculty of Health, in terms of graduating more nurses. All Saints University, which is also it's a private university, but they also graduate quite a bit of nurses, and most of them, they have been staying here. The thing about it is, you have to also look at the sort of people that get into nursing. For instance, if there were a younger person, early 20s, entire future ahead of them, they're more likely to migrate, as opposed someone in their mid-30s, most probably married, most probably have some kids, most probably have a little mortgage, most probably have some other commitment in Dominica. These people are more likely to stay home. And we have been targeting these people so that when they do get into this health profession, they would rather stay home because they have certain commitments and certain ties to Dominica, as opposed to a 21 or 22 or 23-year-old who might be, as soon as they get the BSc, they most likely might migrate. So targeting the exact people, that is exactly why most of the community health workers that were trained under PAHO, they were basically in their 30s there, and they were basically sort of stable here at home, and they were from the villages, so they're more inclined to stay as opposed to younger people might just get the graduation and just fly out. So in terms of, we increased the number in terms of the Dominica State College and having the tuition free and all the subsidies and the assistance by the government into the health faculty, as well as the selection of the people that we do for nurses. But obviously that wasn't enough, so we still got nurses from Cuba and just to augment the nursing part. As regards to the private sector, we have little issues here, and that is where the digital aspect of it is going to help us in terms of connecting the private sector and the health aspect of it with the government system. So we have to work here. We have little shortcomings here, I will admit, but it's something that we've recognized and it's something that we're going to deal with as well. But yes, we have the little shortcomings. Even in terms of the reporting in COVID-19, some of it that took place in the private system. That is why we're very careful in terms of where the testing was done and in terms of the reporting of the testing, because that way our numbers and our figures would have been off if the private sector wasn't in sync with what we're doing within the public sector. So we recognize those areas, and I think it's just a matter of just getting together and pulling everything together, whether it's the primary healthcare, whether it's the secondary healthcare, whether it's the private sector. But that's why we're here. That's why we're happy that you're here. So that's why we can make it better and stronger, our healthcare system.
So thank you very much, Mr. Minister, for the tour de force you did with that presentation. And again, I follow my colleagues. The question I want to ask is about the Dominica China Friendship Hospital. When I was at the sub-regional office, I visited Dominica a few times, and I know that the hospital and the governance was under discussion. So I was interested to hear you say that there is now a legal structure where there's a board and if you could share with us the reason for that change in governance of the new hospital, what kind of challenges or issues you expect them to address as a board, because it's now a legal structure, and for the future, what are the kinds of challenges you expect that the board will have to deal with? Thank you very much.
Okay, in terms, well, you see, in all fairness, sometimes when we have health services, you have the Ministry of Health, but sometimes the Ministry of Health might have certain limitations, whether it's in terms of the skill set and whether in terms of the energy and the...
This is the microphone you have to use.
Okay. Right, so, and we wanted to develop a healthcare system that would benefit everyone. And we've had little issues in terms of hospital and secondary and tertiary care. So we thought the best way to do this is to have a hospital authority. That would allow us a better governance, better management. It would be more transparent, and in terms it would also afford some accountability. Because, you know, sometimes when everything is done through the government system, in terms of accountability, there might be little lapses and little gaps here. But with an authority, you have a board, you have a CEO, everyone becomes accountable. So you have different departments, and accountability is a major issue So if we can address accountability, everyone knows who they're reporting to, and it is a systematic approach to just getting a better system, which will be much more transparent as well. So that is basically one of the main reasons why we had to get this, our authority. And it goes much further than that in terms of accreditation, in terms of just how the services, because what we want is when patients come to the hospital, we want them to have the best possible experience, but also the best possible outcome for their condition as well. And with increased accountability and transparency, I think these are the ways to get to that area here. So, and it's just been, actually, well, we started off last year. It was passed in the Parliament last year. But we've seen differences already, just in terms of the whole attitude and how the healthcare workers, it's just a new sense of energy and just the whole optimism associated that, look, we know we have people who care about us, not that we not caring before, but just that there's that new sense of energy and that new zeal in the whole system of how we produce, how we provide hospital care to our patients. So, and I think we can definitely see the benefits so far, and we can only look forward to getting it better and stuff. So even this week, with all the different consultations taking place with the PAHO experts and with our hospital authority, everybody's excited about the possibilities to provide a much better healthcare system. And I think that's just the way to go. Not only in Dominica, I think in quite a few of the Caribbean islands, they've gone the authority way, having a board to handle the hospital. And so it really means a lot to us. And we're really looking forward to that. But definitely we've seen the benefits so far. And I know for sure it's because of just the whole management structure, the whole system of how everyone reports and the whole accountability and the transparency, and also in terms of how we finance it and how we manage it and make it sustainable as well. And that has brought some benefits to us, and we just look forward to it getting better and better.
Minister, the last question, and then we'll pass the mic to Dr. Etienne for closing remarks.
Thank you, Minister. Good morning. My name is Marian Paralazo. I am the Director of Communications at PAHO. And within the framework of the all-government approach, and having here the Minister of Trade, I would like to have your take, your perspective in terms of one very important issue, which is food security, related to health, related to climate. I understand Dominica, as other Caribbean countries, is quite vulnerable to shock prices, food prices. There has been an increase in the food prices, and more are expected due to the war in Ukraine. I would like to know what is your take in terms of the challenges in food security and health. Thank you.
Okay, it's a very good question that you're asking here, because it's something that we as a government, we are fully aware of, and I made mention it in my presentation earlier. And for this, we are definitely going to have a multi-sectoral approach. And that is where the Ministry of Agriculture and the Ministry of Trade have been well on board with us in that regard. We have actually many agricultural programs directed at this food security question that you brought up. And many programs that we have as a government, because we recognize, as I said in my presentation, this is definitely an issue, and this is something we have to address. So many of our agricultural programs, many of our trade initiatives, together with the Ministry of Health, to address the food security part. There are lots of different agricultural programs. I could go into a long detail of that, but I can also provide you some of the information on those specific interventions through the Ministry of Agriculture, through the Ministry of Trade, that we have identified and we have aligned ourselves with to address the food security issue. As a matter of fact, during the COVID-19 pandemic, one of our main aims as a government was, in simple layman's term, to keep the stomach filled. And that we did pretty well. We had lots of initiatives, even on a local government level, just to make sure that the food distribution and the food chain wasn't interrupted. And I think we did pretty well in that regard, in making sure that the food chain was interrupted. But in the long term, yes, whether it's in terms of the fisheries department, whether it's in terms of our tissue culture department, Ministry of Agriculture, in terms of our different seedlings, in terms of our supplies, in terms of our supplements, and all the different fertilizer and everything that's going out to the farmers to make sure that we can produce enough food. And in that regard, we have been doing pretty well in that regard.
Minister, with your indulgence, Dr. Barbosa would like to ask a question.
No, thank you. Minister, it's more comment than a question this because I had the opportunity to see how you are committed with vaccination yesterday in the morning, with the transformation of the health system, primary health care. So first I want to congratulate you for this very important, comprehensive presentation, very transparent, and I think that is good to see how clear you have the achievements and at the same time the challenges. Because this will guide our technical cooperation with Dominica to see what are the important topics that you and your team have identified as a challenge in the region. I think that my brain is trained to get some discrepancies when I see some numbers. So I personally don't believe that you have doubled the child mortality rate in Dominica in 20 years. It's not feasible. Probably you are paying the price to improve the vital statistics in the first instance. So I think that it's important that our EIH department, working together with the ECC country office and the focal point here, can review the data. The statisticians say that everything under 20 is very difficult to deal with, and I saw that you have exactly 34 deaths each year for child under 5, so maybe it's all some lack of stability of the data, but probably the estimation that was provided for 20 years ago was much less accurate than the estimation that we have now. So I think that's important to solve the mystery, because it will improve the vital statistics, and at the same time it will also guide the action that you need to implement to reduce the neonatal mortality. That in countries that reduce the child mortality, the most important portion remains as the neonatal mortality, and they are more challenging. And they will, but primary health care can provide a very important role to provide a better antenatal care, and also the hospitals, and this is a very, very important topic indeed. So I think that we need to work with your team on that to present, I think that a more clear diagnosis about what's really happening with the child mortality in Dominica. And again, congratulations. I think that you have a very clear roadmap, what are the priorities, and that all technical departments in PAHO that can work with the country office and how we can work together to put this and to make this happen in Dominica.
Thank you. As a matter of fact, it did occur to me that the numbers were, I just wasn't convinced. But I wouldn't want to just put it as making excuses. So I was being honest and frank enough. But at the back of my mind, I knew something wasn't adding up. But let's take it from there. Let's just take it right from here. And we'll get the correct numbers with the assistance of EIH, and yeah, definitely we'll get the correct numbers. But I don't want to just look like I'm making excuses. I want it to be as transparent, as frank as possible.
So, Honorable Minister of Health. Yes, okay. With McIntyre. So let me just say thank you for what was a very insightful, comprehensive presentation that fully outlined where you are in the broadest possible terms in health in Dominica, and frankly laying out clearly the challenges that you confronted. I must say there has been significant development in health over the years. I note the full commitment of the government for investing in health, the full commitment for ensuring that your hospital and first level of care are strengthened, the commitment in getting people at the very center of health and to reignite community participation in a meaningful way. We hear what you are doing in terms of climate resiliency and the way you are not only but as the government focuses on resilience, climate resiliency, that health is an important part of it. Because very often health is left out of some of those initiatives. And so I also want to congratulate the Cabinet for their engagement and for working across sectors. And if we are going to successfully address NCDs, this is going to be more and more important. And Cabinet, and led by the Prime Minister, if you move forward in a multi-sectoral manner, intersectoral manner, I think that we could engage. I note also your drawing in of the private sector, and that's important, and that's one of PAHO's not so active approaches, but we recognize that you cannot advance health without engaging the private sector as well. And so you've already begun to do this. So we are hopeful. We are hopeful as PAHO that we can work with you with the commitment and determination that we found, with the degree of advancement that's already at the country, that we can work with you to advance the health and well-being in Dominica, to enhance quality of care, to provide an environment within which people can live healthier lives. And so we look forward as PAHO. You have the representatives, PAHO representatives of all of the Caribbean countries here. They've listened to you and they know the situation in their own countries. And I am sure that they will be looking forward to what is happening in Dominica so that we all can learn together, because that's one of the objectives. That's one of the objectives that we come together as a sub-region, in a sub-regional managers meeting, to learn from each other and to develop common strategies to address the common issues in each country, with the specificities that are necessary for each country. So let me give you the full commitment of PAHO. You can be sure that PAHO, as it did in the first 120 years, will continue to work very closely with our governments to deliver technical cooperation. We are actively looking at our technical cooperation in the post-COVID era as we transition as well, so that we can be ahead of the curve in terms of determining how we implement some of the lessons that we've learned, how we change some of our strategies and our approaches, so that we can always be ahead of the curve, and that our member states can continue to be ahead of the curve as we speak on health issues and as we implement health issues. Because we do know that the future will never be like the past and the immediate past. So we know that we need to change tack, we need to change strategies if we are going to meet the UN Sustainable Development Goals. And as you identified the 5 Ps, we know that because of the 5 Ps, we need to change and to accelerate towards the SDGs. Minister Douglas, thank you again for being with us. I'm sure as you sat here, you were very proud about what your fellow minister and the government as a whole has achieved in health in Dominica. You have been introduced, I think, like never before in terms of the challenges that confront the Ministry of Health. And we hope that we can enlist you as an ally in Cabinet to fight for health alongside the Minister of Health. So it has really been an immense pleasure to have both of you here with us today, and for having listened to us. And let us thank the media as well, the local press, and also PAHO media for being here with us. I think that you've gotten a really very good expose of what is current in your Ministry of Health and in your health sector of Dominica. So thank you for transmitting that information to all of the peoples of Dominica. And I say thank you to the Prime Minister and his government, but also thank you to the people of Dominica for all that they've contributed to this, to making health better in Dominica. And we look forward to their full engagement as we move one step further, closer to health and well-being for all, closer to health services that can deliver to the best of their ability. And PAHO will be with you as you go along this journey. So thank you, everybody. Thank you very much.
Thank you, Director. Thank you, Ministers. In conclusion, we have to take the official photo, so I asked the two ministers to join us with all the delegates outside to take the official photo. And for the delegates, you have received a message in your emails to register for the different trips that we are going to see, to make sure that all of us see the beautiful island of Dominica, not just the constituency of Portsmouth. Thank you, everyone, and we'll